This is Debbie Bucher for Parkland College, and this is for the LPN to RN Transitions course. And today we're going to be looking at Chapter 15 in the LPN to RN Transitions book by Laura Claywell. And Chapter 15 is Promoting Healthful Living in the Primary Care Setting. Primary health care promotes preventative care, as well as independence of healthcare services. Everyone moves along a health-illness continuum, moving between states of illness, and states of wellness throughout our lifetimes. And these include times that may include dependence as well as independence. And then primary health care is maintaining independent, healthy individuals in a community. Adults seek assistance when they have a self-care deficit and they can't manage this. Nurses are involved in health promotion when the following take place. People are under the direct care of a nurse. The nurse is engaging in practices that prevent or interrupt the disease process in the environment of the patient. The nurse is guiding people toward health prevention methods. And the nurse is incorporating factual information about the patient into the plan of care. And the nurse is aware that the adult or responsible adult will be the primary person to carry out the plan of care. The RN works with people to help maintain health promotion in people who are experiencing life or developmental changes. Health promotion is done by nurses, educating people on how to be an independent self-care agent. And next is just a slide that is looking at the theoretical framework for the health illness continuum. Again, everyone moves along this throughout their course of life, so including our patients that we take care of. They move toward the direction of health and independence, or they move in the direction of illness with dependence. Orem believes that every individual has some self-care ability, which is the day-to-day personal care needed to function and develop. The ability is affected by several things, including but not limited to the patient's age, the developmental stage, health, and environmental factors, and adults seek assistance when they have a self-care deficit. Self-care ability can be affected by many things, and nursing care is sought when a self-care deficit cannot be resolved without specific medical and nursing knowledge. The RN should model and encourage health protective behaviors. Many factors influence health promotion, including individual perceptions and experiences, and interpersonal and situational influences. An example, a patient has a broken leg and needs to have time off and is concerned about her ADLs and is going to catch up on reading, whereas another person is anxious and has trouble asking others for help. As a nurse, we need to have health protective behaviors and health promotion behaviors, such as deciding not to drink or smoke. The Pender's health promotion model states the characteristics and experiences that are influenced by the person's perception and as well as interpersonal and situational influences on health. Health promotion model, key to the model are characteristics and experiences influenced by the individual's perceptions and interpersonal and situational influences on health. Every factor has some degree of influence on healthy behaviors, and the nurse should consider these behaviors to know how to assist the patient. Health protective behaviors take a person away from a dangerous situation or habit. Health promotion behaviors move an individual to a higher level of health, greater vigor, or energy. Okay, health promotion principles. The health promotion plan of care includes education and self-actualization exercises to help the individual seek a higher level of health. Priority for health promotion is helping the patient regain control over his or her own health. Priority nursing diagnoses are health-seeking behaviors and knowledge deficit. Outcome criteria, progress toward a higher level of health, as well as including the patient as a means to empowerment and compliance. The health promotion plan of care is holistic, comprehensive, and encourages the patient to regain control of his or her health through education and self-understanding. Include the patient as a means to empowerment and compliance, and the RN's role in health promotion it is helpful in designing individual plans of care. A health promotion plan of care needs to include education and self-actualization to help someone reach a higher level of health. Example, someone needs to lose weight, but first they need to understand why they are overweight to begin with before they engage in a weight loss program and needs to come to terms with the basis of the weight program. The plan of care needs to address all areas of health concern. As nurses, we need to help people regain control over their health. Prioritization of nursing diagnoses includes health-seeking behaviors or knowledge deficit in order to aid in their health promotion. Getting involved at a local or regional political level is one way to be proactive in health promotion. You can provide expert testimony to governing bodies in an effort to promote a more positive health environment. A nurse can testify on the effects of environmental pollution on the health of the community. Nurses can educate the community on health promotion in church groups, parent-teacher groups, and neighborhood associations to focus on community health issues. The RN can also be proactive in health promotion, again, on a local or regional political level. So question, a nurse is providing health promotion to a patient with developmental needs. Which needs are the nurse trying to meet? And it's 4, trust and belonging. So developmental needs such as trust, love, and belonging change as a person moves through each life cycle period. A universal need is an essential requirement for everyone: food, shelter, air, water, and other basic needs. Okay. Environmental influences on health promotion. Everyone exists in an environment. It can be supportive or stressful. The components are the physical environment, which are the tangible factors where the individual lives, begins with assessments of the environment that have been implicated as causing health variations for the individual or the community. The plan of care developed to minimize the negative influence of the physical environment. Interventions that are focused on either avoidance of the environmental factors or modifying lifestyles to minimize their efforts. Health promotion interventions focus on either avoidance of the environmental factors or modifying lifestyles to minimize their effects. A plan of care is developed to minimize the negative effects of the physical environment. The influence of the patient's environment must be considered when assessing healthcare abilities. Physical factors are concrete and can be measured. When it is not possible to remove or eliminate the physical factors that affect patient's health, creative solutions must be sought to minimize the influence as well as satisfying the patient. So Erickson's 8 stages of development are stage infancy, and the associated task is trust versus mistrust. Stage is toddler, and the associated task is autonomy versus shame and doubt. Early childhood is initiative versus guilt. Middle childhood is industry versus inferiority. Adolescence is identity versus role confusion. Middle age is generativity versus stagnation. And old age is integrity versus despair. Adaptive abilities come from cultural, hereditary, and environmental influences, and social self-actualization is a person's understanding of his or her abilities and roles in a culture, community, society, or world. Because developmental factors affect health-seeking behaviors, the RN must include the role that these factors play in the patient's health in order to initiate a plan of care in collaboration with the patient. Patients cope with stress in different ways. Unhealthy stress behaviors should be addressed and the patient presented with alternative strategies to maintain an optimal health environment. Health promotion is part of the nurse's role. Many organizations and individuals provide primary health care. The family nurse practitioner and the family practice physician are primary health care providers. Patients seek them out and trust that their counsel will help keep them well. Primary services such as physicals, immunizations, screening for potential health problems, and monitoring health and well-being are other things that we can help promote as nurses. Primary health care systems include primary care physicians, state and local health departments. Health departments follow strict regulations and funding is often limited to outcome measurement. Public health focuses on health promotion and focuses on public policies that help dictate the economic and bureaucratic structure of agencies from the World Health Organizations as well as the state and local health departments. The main focus is setting standards for health, interventions to meet standards, and evaluate the outcomes to improve the general health of a community. The RN can refer to the family practice physician or the nurse practitioner as they are part of the healthcare promotion plan of care. Public health, setting standards for health, implementing interventions to meet the standards, monitoring the outcomes in an effort to improve the general health of the community, as well as focusing on actions that minimize potentially widespread health problems. That's very important. Healthy People 2020 is a national effort to improve the lives and health of all Americans. It addresses many health issues, and we have a responsibility to promote these healthy objectives for both us, ourselves, and our patients. Health promotion can directly eliminate hazards or threats to health, as in the EPA, or indirect, such as educational programs that present lifestyle changes and inoculation programs to reduce the incidence of disease. Health promotion takes a multiple approach with agencies at the local, national, and global levels. Health promotion is a global concern, inviting input from organizations such as World Health Organization, the and the U.S. government. Supported by the U.S. Department of Health and Human Services, Healthy People 2020 lists objectives for more than 40 topics that are national health concerns. Healthy lifestyle will bolster your self-confidence, can model lifestyle changes for others, especially patients. You practice what you preach, as well as you lend credibility to your role as a patient advocate. Maintaining and modeling a healthy lifestyle will bolster self-confidence and minimize the stresses of balancing family, education, and career. Self-health promotion lends to credibility to your role as a patient advocate. We need to practice what we preach, which is very true. So this concludes the lecture portion for the chapter 15 in the book by Laura Claywell, Promoting Healthful Living in the Primary Care Setting. Thank you.